The Pediatric Endocrinology Fellowship Program at St. Christopher's Hospital for Children is a 3-year training program that offers a comprehensive learning experience. Our program is a medium-sized program. The main goals of our program are to train outstanding clinicians who are at the same time effective educators and successful physician scientists. We do this by emphasizing both evidence-based clinical care and outstanding scholarship. Just to give you a brief summary of our program, the first year of training is primarily devoted to gaining clinical expertise in pediatric endocrinology and diabetes. The goal is to support the fellow in the process of learning the cardinal elements of endocrine physiology and pathology with exposure to patients in both the inpatient and outpatient setting. This is the most clinically heavy year. The learning curve for our first-year fellows who are enthusiastic, hardworking, and motivated is very steep. Fellows during their first year also learn research methods and techniques and develop a research hypothesis, since a scholarly research project is an American Board of Pediatrics requirement. Research opportunities at this time are mainly clinical. Applications for research grants for salary support is recommended, but is not essential in our program. The second and third year of training are mainly focused on research activities with a gradually decreasing involvement in clinical training. And over the 3-year period, trainees gain more autonomy and responsibility in leading work rounds and teaching, as well as presenting his or her research project at both national and international conferences. Multidisciplinary conferences such as Tumor Board, Pediatric Endocrine Radiology Conference help us to learn from our colleagues more regularly in other subspecialties here. Our own monthly data clubs, journal clubs, and morbidity and mortality conferences, as well as our weekly clinical conferences, are a wonderful way for the fellows to present interesting cases and to learn more about differential diagnoses and treatment and the management of less commonly seen disorders with attending input. I myself trained at St. Christopher's Hospital for Children for my own residency and fellowship. St. Chris really is more than just a freestanding children's hospital where the majority of subspecialists are here with whom you can collaborate or learn from, and they're only just a phone call away. St. Chris really is a family.
St. Chris is one of the oldest pediatric hospitals in the country, and it's exciting to be part of an institution that has helped shape the career of pediatricians for over 100 years. Working here, we are reminded of the important figures in history of pediatrics who became part of St. Chris, including Dr. Nelson and Dr. DeGeorge. Doctors who work here at St. Chris are very committed to providing the highest quality of care, as well as fostering a sense of community among colleagues. Our goal is to instill in all trainees a spirit of inquiry and a love of learning that they will carry with them as they go on to their career as a pediatric endocrinologist.
I met a pediatric endocrine fellow when I applied, so now it's my turn to share my story. I chose the endocrine program at St. Chris for the following reasons. St. Chris has a great reputation, not only as a community-focused children's hospital, but it is also known for its endocrine and diabetes section. All the wonderful people I met during my interview who made me feel like I can easily fit in and be part of this team. They were so warm and welcoming. In our outpatient setting, we have the endocrine and diabetes continuity clinics that have taught me how to manage a great array of endocrine disorders and to establish a special kind of patient and parent relationship. The diverse patient population obviously contributes to that, but it also brings a sense of cultural sensitivity, the value of understanding different aspects of humanity that is both humbling as well as vital for an aspiring physician. As my skills have gotten stronger, I have been given more autonomy, and I really see my attendings as my colleagues, and I know this is a mutual feeling. I have also gotten the chance to teach more and give more conferences, which has raised my level of enthusiasm, something I think we all need in these challenging times. Last but not least, the city of Philadelphia is a vibrant place to live and work in. It is full of diverse and great restaurants, has wonderful outdoor areas. I'm still trying to cover all the trails out there, but I don't think one can. And it is also in easy commuting distance to New York City and DC. I have less than a year left until I complete the program, and I already feel confident that the program has prepared me to take on this wonderful world of pediatric endocrinology. And I hope I get a chance to meet you soon.